you've referenced the autoimmunity spectrum. What exactly is obviously a spectrum is a linear evaluation of certain, I think, diseases that fall upon that linear progression. But in your interpretation, what exactly is an autoimmune or autoimmunity in spectrum?
The autoimmune spectrum was first, I'm not sure it was first identified, but I first learned about it in 2003. Dr. Melissa Arbuckle, an MD, PhD, she went to the VA hospital in her local area and she looked for people with lupus, the autoimmune disease lupus. She found 132 people with lupus in this one VA hospital. Now, if they're in a VA hospital, they're veterans.
Mm-hmm.
If they're veterans, they were in the armed forces. If they were in the armed forces, they had their blood drawn many times over the years in the Army, the Navy, the Air Force, when they were healthy. And what most people don't know is that the government's been saving and freezing all of that blood since 1978.
Yep.
They've got tens of millions of samples of our service people's blood. Now, Dr. Arbuckle knew this, and so she went to the VA and asked for permission to look at the blood of the currently diagnosed lupus patients when they were healthy in the Air Force or the Marines. And she received permission. What did she find? She found that every single lupus patient had the 7 antibodies to lupus elevated years before they ever had symptoms. Years beforehand. And that every year that those antibodies went higher and higher and higher and higher. And when they plateaued was when the symptoms began. And it took those people 2 to 3 years to get the diagnosis of lupus after they started going to doctors, because doctors couldn't figure out what was wrong with them. But it all began back here when the antibodies were elevated. So let's talk a little about elevated antibodies and what does that mean?
Okay.
Remember, the antibodies are the adaptive immune system, the big kahunas, the ones with bazookas, right?
Yep.
So when is it normal to have antibodies to your own tissue? There's one situation when it's normal. For example, if you do a blood test for thyroid and you look for thyroid antibodies, there's a reference range. If it's between 5 and 34, that's normal. If it's above 34, that's abnormal. And it depends on the lab. The numbers can vary. But the concept is there's a normal reference range, and then there's high.
Right.
So when is it normal to have antibodies to your thyroid? Every day. Mrs. Patient, you have an entire new body every 7 years. Entire new body.
Yeah. In your intestinal tract, it's what, every 7 to 14?
3 to 5 days.
3 to 5 days, right.
Yeah, right. And some cells, like bone cells, are really slow, but every cell in your body regenerates. You get new cells every day, every day. How does that happen? Your immune system makes the antibodies to get rid of the old and damaged cells. And when you get rid of the old and damaged cells, it makes room for new cells. And then you develop new cells. So if you have between 5 and 34 thyroid antibodies, you're in the normal range. You're losing as many cells as you're making. Right. You're killing off as many cells as you're making. That's the normal range. But when you have elevated antibodies to your thyroid, you're killing off more thyroid cells than you're making. And no big deal for a day or 2 days, but weeks and weeks and months and months, and there's no symptoms when you're killing off thyroid cells. Absolutely no symptoms until you cross a line. It's an imaginary line somewhere, and when you cross that line, now you start getting some thyroid symptoms. You get cold hands and feet. It's hard to get up in the morning. You wish you had 20 more minutes in bed. You can't lose weight even if you don't eat for 3 days. You feel a little depressed. These are all signs of thyroid dysfunction.
Right.
But you don't get those until you've killed off enough thyroid tissue that the thyroid just can't work right anymore. So the spectrum of autoimmunity is when you first get elevated antibodies, and that goes on for years until you kill off so much tissue. Now you start getting symptoms, and then it takes you 2 to 4 years to get the diagnosis, and now you think you've got an autoimmune disease yesterday. No, you didn't. You got the autoimmune disease way back here, early in the spectrum. But nobody knows to check for that. But there are blood tests now, and it's all talked about in the book. There are blood tests that you can have your doctor do to see, do I have elevated antibodies to my brain?
Right. And I think one of the tests that you talked about, I think, was Cyrex. Was it Array 2 or Array 3?
5.
Array 5.
Five with Cyrex Labs is the one for autoimmunity.
Okay.
Vibrant Wellness has their neural zoomer that looks at your brain. It's really comprehensive to see if you. I had 3 antibodies elevated to my brain.
And that
3.
that was through Cyrex.
That was through Cyrex.
Okay.
And this was 1997. This is when it was research only.
Mm-hmm.
And I called the lab and I said, "What's this? This is a mistake." They said, "No, it's not." I said, "Do it again." They said, "We did. We know it's you. We did it again. It's accurate." And that's when I got religion about all this.
Yep.
Because I had elevated myelin antibodies were elevated. That's what causes MS. Cerebellar antibodies were elevated. That's why old people can't run up and down the stairs. They don't have the balance anymore to do that. It's because your brain's been shrinking.
Mm-hmm.
And ganglioside antibodies, that's what causes the whole brain to shrink and causes cognitive decline.
Right.
And I had all 3 of those elevated, and I was 44, and I said, that's not right. That's not right. What is this? And that's when I really started studying this and reading more research and dialing it down. And then the outcome is this book.
Yep.
So you will get cutting edge information when you read this book. And some people say, oh, he's plugging his book. You're right. Shamelessly, I'm plugging you. You want to live a long and vibrant life and protect your children, you need to understand what you're up against.
Yeah. No, don't even feel ashamed about plugging your book, because like I said, I have had thousands of hours in this type of training. Obviously, you've had a lot more with your functional medicine, expertise in different things. But I still thought I had a pretty good idea of what was going on. After reading your book, I felt like I should be like going back into kindergarten. It's like I really was embarrassed about what I did not know in autoimmunity, and we haven't even gotten into the microbiome yet.
Yeah.
When it comes to this, we're just talking about kind of in general
the big
terms,
picture,
the big picture, right? And I would like to at some point, get into the microbiome part of it. But yeah, I mean, everyone.
Well, Dr. Harris, one of the common triggers for cancers in our body, different types of cancers, is all these toxic elements that we're exposed to that causes our cells to mutate.
Right, and you're talking about, again, years ago, not just a few months ago.
Right. The accumulation of all this stuff, just like women, we talked about with breastfeeding. It's the accumulation of all these toxic chemicals. I mean, you can't be putting these cosmetics in your hair or on your skin, and you read the label, and you don't even know what this stuff is.
Yeah, I mean, who can produce phthalates? All the different things that they have in there, and they're putting them on their makeup, their skin. Their lipstick, their eyeshadow, their face cream, and it's just amazing when you look into these ingredients of what women are putting on their face. Some men too. I'm trying to be sexist, but because some men put it on too. But what people put on their skin is just horrible in terms of what's in there.
I went to the movies the other night, and I was startled at the Coca-Cola commercial. That it was a 20-something, pretty young girl, all vibrant and bouncy. They did all these different scenes with her and all this background happiness going on. And she said, if you want to do organic and live in a yurt, that's fine if you want to, but that's not for me. So they just trashed organic living, organic foods that quickly. But I'm going to do what I want to do. Right. And I can do what I want to do because I can. Right. And I want a Coke. And then she drinks a Coke. So these marketers are encouraging people to take these things that are just as toxic as can be to our bodies.
Yep.
It's a horrible thing. The shaving cream that men use. Listen to this. A meta-analysis. A meta-analysis is when you look at a number of research studies on one topic, the same topic. They did a meta-analysis on sperm count in healthy men. Between 1974 and 2011, in 37 years, they looked at 186 studies in 37 years, and what did they find? They found the average is a 59% reduction in sperm count around the world in the last 37 years. 59%. Now, scientists worry about extinction of a species at 72%.
And
what do you think is going to happen in the next 20 years?
Yep.
You know, why is this happening? Because these endocrine disrupting chemicals bind onto testosterone receptor sites in men.
Yep.
And they don't make enough testosterone, they don't make enough sperm. In women, it binds onto the estrogen-loving cells. In men, the testosterone-loving cells.
Okay.
This is what we're up against, and nobody knows this. Everybody's in the dark.
Now, did that study ever go into, not just in terms of the reduction, but the abnormalities of the sperm cell? Were there actually genetic changes within the cells?
Yes, they did.
Not
The most important point for the big picture is sperm count for fertility and continuation of the species. But you're absolutely right that the amount of, it's called morphological changes, was huge in the sperm. Most of the sperm that they found was damaged.
Yep.
Most of it is.
Yeah, that's not a good thing. So.
No, and you can't do anything about your sperm, but you can do something about what you expose your body to that affects your sperm.
Right. I totally agree. All right, so let's switch gears here a little bit. Let's get into maybe a little bit of the economics in terms of how much this is actually costing U.S. government, how it, in other countries, how many people are coming down with autoimmune illnesses and secondary consequences of cancer and infertility and Parkinson's disease and neurocognitive disorders and cardiovascular.
There are over 70 million people with a diagnosable autoimmune disease. Now that's when it's diagnosed.
Currently,
70 million people. That's when it's diagnosed. So remember the spectrum. How many people are on the autoimmune spectrum? Almost all of us. When you do the right tests, so that they clearly can identify, do you have a problem right now? In clinical experience, somewhere between 5 and 7 out of every 10 people have elevated antibodies to their own tissue.
Yep.
And they don't know it because it hasn't killed off enough tissue yet to cause the symptoms.
Again, as you said, it takes 5 years or so for those symptoms to develop.
Some of the diseases it takes 20 years.
20 years.
Primary biliary sclerosis. If you've got the elevated antibodies, it's 100% guaranteed you're getting PBC, primary biliary cirrhosis, in 20 years.
Okay, so if you went back 15 years and you did, I guess, a blood test, I guess it could be a urine or a saliva test. Well, let's just say it's a blood test.
Right.
And this particular enzyme came up high. There's a pretty good correlation that you're going to get this disease 15 years down, 100%.
And there's another one that's 100%. Saccharomyces cerevisiae, which is a normal yeast in the gut, but when you make antibodies to Saccharomyces cerevisiae, they're called ASCA antibodies, ASCA. If you have elevated ASCA antibodies, it's 100% positive predictive value. You're getting Crohn's disease in 3 years.
3 years. Okay.
For Crohn's.
All right. So why doesn't the government or the powers that be look at these tests and say there's 100% predictability that if you have these markers, these biomarkers for these diseases, that we can actually put you on some type of protocols that actually will help you. Why can't we be more proactive with these biomarkers than reactive? Because as you said in many of your betrayal in your the Autoimmune Fix, it's much easier to stop something from happening than to fix it when it already happens. So we have
really good question. Really good question. And the answer is The answer is very clear. It was published in the British Medical Journal a few years ago. 17 years. The average, not the exception, the average is that it takes 17 years from when translational research, meaning cutting edge research that's right on the money, that's going to turn around some topic, translational research, 17 years between when it was first published and when the doc down the street is implementing those ideas. 17 years.
Okay.
That's the resistance of our medical system. What's the harm in checking to see if you have elevated antibodies? You have to pay for it. That's the harm. It's about $300 to $500 to do the test to find out. And if your insurance pays for it, great. If they don't, it's an investment. And when you look at it and you see it, and then you read the book, the Autoimmune Fix, and you say, oh my gosh, I understand what this means. All right, I'm going to dial down why this is happening to me. What is it? Is it mercury? Is it polysorbate 60? Is it BPA? Is it other heavy metals? But you're not going to research and to look and see where the problem is coming from when you don't know you've got the problem.
Right. But if you did a test, be more proactive, you kind of would have a little bit of an idea that it may be.
Oh, you bet.
It may
you bet.
be coming.
It'll scare the heck out of you. And
Well,
it's supposed to.
It's supposed to is right.
Wake up. Wake up, everyone.
Okay. So what's the block? Is it finances? Is it government regulation? I've worked very well with a lot of good MDs in my area.
Let me give you an example.
Is that the MDs just don't want to admit that there are other tests that they don't know about?
What's the block? I'll tell you the block. The shirt you're wearing now, the shirt, was that dry cleaned?
No.
Okay.
I try not to get them dry.
Good. The vast majority of people have their clothes, professional people, they dry clean their clothes, right? That means these shirts and these ties, they're loaded with the toxic chemicals from dry cleaning.
Right.
And you're breathing it all day. Here's an example for you from the book. When you're pumping gas, do you sometimes smell gas?
Oh, God, yeah.
Yeah.
And you get it on your hands, it drops on your shoes. As careful as you're trying to be, you're going to get some type of gas on you when you're pumping gas.
But without spilling it, sometimes you're just standing there and you smell it.
Right.
You're downwind.
Absolutely.
You're downwind and you're smelling benzene, which is a brain toxin. So what do? You have to pump the gas, walk around to the other side of the hose. Now you're upwind and you don't smell it anymore.
Okay, something as simple as that.
Yeah, but people don't think about this kind of stuff. They're not trained to think about how to protect themselves.
They're not taught how to do that.
That's right. That's what this book is about. It's to wake up to the number one mechanism in getting sick and dying in the world today. The number one mechanism is your immune system trying to protect you. This is what causes Alzheimer's. This initiates cardiovascular disease. This initiates cancer. It's the number one mechanism.
Right. So I want to talk to you about a little bit of the economics in living in a poorer area of Vermont or the country. Now, we have a lot of dairy farmers, Tom. We have a lot of people who grow corn. We have a lot of people who grow wheat. It's extremely poor. People tend to stay here. They don't tend to go to college. So in my practice, I have a lot of farmers who, are dairy farmers who grow wheat, who grow corn, who have a lot of pesticides, herbicides, Roundup that are put on their crops every single year. And there's a kind of a dichotomy. And one of the things I think you mentioned in your Betrayal series is that people tend to, especially mothers and fathers, tend to scrub their children clean. God forbid they have a little bad bacteria on them, right? So Johnny, gets into the sand and they bring him in the house and they scrub him to try to get this bacteria off of him. You and I know that's not a good thing. Our immune system is based on biodiversity, that we want our immune system to be exposed to a bunch of different antigens so we can develop the antibodies to it so we can have a much healthier immune system.
Right.
And one of the things that I think you talked about in your betrayal series is that people, when you look at the urban, suburban, rural type of lifestyles, that kids who grew up on farms tend to have a better immune system because they're getting exposed to a much more diverse, bacterial, viral, fungus, whatever it is, because, that's what they live in every single day. And their immune system can adapt, produce the antibodies to it, so they're a lot healthier. Has anyone done any studies to show that, these rural kids who grow up on farms have a better immune system because they're exposed to a lot more diverse bacteria on a farm as compared to an urban environment, as compared to a suburban environment? So people in this area, very rural, very agricultural, do they have better immune systems per se, with that only being the only variable, than someone who's growing up in an urban environment that's not exposed to all the different farm, I don't want to say toxins, but the different bacteria, the different viruses, things like that. Is that a good thing for people who are here who are exposed to more diversity?
Well, in terms, I'm just looking for the name. I can't remember his name. I interviewed him in Betrayal. This guy has a family farm. I believe it's in Virginia. It's 4 generations. And what they do, the produce that comes out of their farms, the volume, the tonnage per acre, the number of cattle that they can raise per acre, all organic, is head and shoulders above everybody else, above the national averages, much more productive, profit-driven, generating a lot of produce and product out of their, I don't know, I think it was 800 acres, I'm not sure what it was, but it's because of the natural methods they use. So the concept of farming is an excellent one to be exposed to bacteria, you bet. But unfortunately, many of our farms today are so chemically driven, and these children are getting exposed to so many chemicals, they've lost that benefit. Right. But I'll give you an example. There was a study that came out that showed that children who live in a house with no dishwasher have 40% less allergies than children that live in houses with dishwashers.
Really?
40%.
Wow. Okay.
Why is that? Because when you wash dishes by hand, sometimes there's still a little crud on the fork. And then you're using the fork in the next meal, so you're getting some bacteria. And not a lot, but a little, and that trains your immune system to be stronger. That's why living on a farm was supposed to make you healthier, is because you're exposed to little amounts of different bacteria and things, and so your immune system gets stronger, and you get stronger to handle it. But now with so many chemicals on most farms today, it's the exact opposite. I'm sorry, I don't remember the name of the guy. I think it was Patrick, or I just don't remember his name. But it was a great example of how a farmland, and he talked about how children, parents bring their autistic children there, and when kids eat these particular eggs, their eggs, in his example, their brain function improves dramatically compared to eating other eggs.
And what's the difference in those eggs? Organic, free range?
They're organic, they're free range, they're higher in omega-3s, which are the raw materials for your brain cells. There's probably a number of benefits that are not in the standard commercialized eggs. The point is, people's bodies thrive when you give them pure food. People's bodies decay and break down when you give them junk food. Okay.
Which makes perfect sense. I remember reading, I think you grew up on Mountain Dews and cupcakes or something like that.
Mountain Dew and Hostess apple pies. Right?
Yeah. Well, same thing. I grew up on, a bunch of different soda and Hostess Suzy Q's.
Yes.
So,
yes, right.
So same thing. That was my staple growing up. So. Okay, so let's we're kind of running out of time here a little bit, and I want to kind of make sure we can get as much as we possibly can. So we kind of talked about some of the outlying things about autoimmune disease and different things like that. And you have done a great job explaining so many different things. So let's dig deeper now into a little bit of what's called the microbiome. All right, what is a microbiome? What does it consist of? Why is it beneficial? Because I think people think, oh, I know what the intestinal tract is. I know that you eat a certain food, you get some pancreatic enzymes, you get a little you get a little peristaltic, move it down into the large intestines. It comes out, and that's about the extent that they really know about it. But reading your book, listening to your Betrayal series, the microbiome is key. And I know you're not going to be able to talk about the microbiome in less than 5 minutes, but if you can give me a really good synopsis of what the microbiome is in the intestinal tract, what it is, how important it is, how it affects autoimmunity, I think people would be fascinated to know just how the direct correlation between autoimmunity and how healthy your gut is, your microbiome, and how that whole thing works together.
Sure.
I know I put you on the spot here because it's a little bit of a challenging question. It's not a yes or no. It's not a yes or no answer.
Scientists now know that the largest organ in your body is the bacteria in your gut.
Mm-hmm.
There are 10 times more cells of the bacteria in your gut than all the cells in your body put together.
Right. I think
How is it possible?
I think George Bland. Was it Bland? I think he came up that in 1 gram of stool, there are more bacteria in 1 gram of stool, 1 gram of stool than there are stars in the known universe. 10 to the third to the 13.
Jeffrey Bland.
Jeffrey Bland.
Yes.
Yeah,
that's true. That's true. When you think,
that's amazing.
When you think about this, and there's 100 times more genes in that bacteria than in the human genome.
Right.
The human genome has 23,000 genes about. Right. Well, there's 100 times more in the microbiome. Mm-hmm. And genes control function. We now know, there's no question, the bacteria in your gut sends messages up to the brain. Mm-hmm. For every 1 message from the brain down to the gut, there are 9 messages from the gut going to the brain.
Now, is that because most of the immune system is in your gut? Is that the
That's correct. 70% or more of your immune system is in your gut. It's the largest part of the immune system is what's in your gut. So that bacteria sends messages up to the brain that tells the brain cells how many nerve hormones to make, called neurotransmitters. Mm-hmm. That's all controlled by what's in your gut.
Isn't that amazing?
So when you've got a bad gut, when you've got bacteria that's not supposed to be there and not enough of the good bacteria, you got a mess. Right. And if you've heard of stinking thinking, that's where it comes from. It comes from having, it's called dysbiosis.
Right.
The environment of your gut is not balanced. We know the number one area in the body being studied in the last 10 years or more in terms of research papers, the most research papers are coming out about the microbiome and how critically important it is to brain health, heart health, liver health, kidney health, gallbladder health. It goes on and on, pregnancy. It goes on and on and on. All of the benefits of having a healthy microbiome and all of the detriments and potential problems of having an imbalanced microbiome. Mm-hmm. If there was only one area of the body I was going to work on, that's all I could work on is one area, it would be the microbiome.
Okay. And how would you work on the microbiome? I know you're a big proponent of gluten-free, dairy-free, sugar-free, and other adjuncts that go on to that. So if you're going to work on the microbiome, why don't you give me like maybe the top 5 things that you would really work on in terms of getting someone's microbiome healthy?
I'm going to do better than that. I'm going to tell you, read the book. There's a whole chapter in the book. This is not simple. It's not simple.
I believe me, I read it and I thought I knew what I was talking about, and I still had to struggle through some of the
Yeah,
chapters.
yeah, because there are so many things to do. And the key is base hits win the ball game.
Yeah, right. I remember
It's
that.
the little steps, the little things you do that will determine whether you are successful or not at arresting and reversing the disease that you may have.
Hmm.
It's all of the little things that you do that make the difference.
Okay, I would agree with that. Now, one of the things that I found a little humbling when I think you said that the human genome. I mean, we carry about 23,000 pairs of 23,000 genes, right?
Right.
Okay, and then you went on to say that an earthworm carries 90,000
Right.
genes. I mean, do you know how small that makes somebody feel? That we are like the top of the food chain. We're the most amazing. Well, I don't know if we're the amazing because we're killing everything off in this world. But an earthworm has almost 4 times the amount of genes in its DNA than we do.
That's a
as
critically
human
important
beings.
concept, Don, and I'm glad you thought about that. It's a critically important concept because what that tells us, it's not the genes that determine what happens to you.
Right.
It's what's going on around the genes that determines what happens to you. That's the epigenetics.
Right.
Humans are the dominant species on the planet because of our microbiomes,
Mm-hmm.
because of what's happening around the genes and how the bacteria controls which genes get turned on, which genes get turned off.
Okay.
That's a critically important concept.
Okay, so we're all been taught when I was in school and I was going through all my pre-med and everything, and it said you have 23,000 genes. That controls everything. That's how
Right, that's wrong.
That's
That's wrong.
everything. And now we're taught that these 150 150,000 more genes in your microbiome, and then we have 23,000 genes. How do those genes in the microbiome actually directly or indirectly affect our health? I mean, how do they do that? What communication system? Is it chemical? Is it what is going on that these genes have such a powerful effect?
When you eat blueberries,
Yeah.
1 cup of blueberries a day, within 3 years, reverses brain decline by 11 years. Your brain will be working as well as it was 11 years earlier when you eat blueberries every day, 1 cup a day, for 3 years. Why?
Mm-hmm.
Because the nutrients in the blueberries turn the genes on to build healthier cells, stronger brain cells. That's how the system works. It's the environment. It's what's going on around the genes that determines which genes get turned on and which genes get turned off.
Okay.
And Dr. Harris, I could stay here forever talking to you about this stuff, and I would love to. But unfortunately, I've got another interview in 4 minutes that I have to go to.
Okay. I'm going to steal you for one minute, okay? If you could give me, or the people who are going to watch this, I mean, I'm not going to say 3, 5, 7. Just give me what your top takeaways are. We've been talking for an hour and a half. You have these different,
All right. Yeah, the top takeaway.
What are your
It's
top takeaways?
It's easy. You have to understand this is a bigger picture than a simple cure. It's a huge picture, and you have to allocate 1 hour a week to learning about this. Within 6 months, you've got it down, and you understand the questions, you understand the dynamics, you're reading the labels on your lipstick, you understand how to live a life protecting you and your family.
Mm-hmm.
This environment is no longer a safe environment. It's an extremely toxic environment we're living in, and it's killing us. It's activating our immune systems to protect us,
Mm-hmm.
and the collateral damage is causing the autoimmune mechanisms of cancer, cardiovascular disease, Alzheimer's, Parkinson's, rheumatoid, multiple sclerosis. All of they're triggers that are being activated by the environmental toxins around us.
Okay.
There's a whole world of stuff to learn. Today, I hope you just understand, you know what? I think I'm going to read this guy's book, or I'm going to watch the Betrayal series. It's
Mm-hmm.
at thedr.com/betrayal. That's the doctor, thedr.com/betrayal. and it's there for you for free.
Right.
You can watch the whole thing for free.
Yeah, and again, I just finished the Autoimmune Fix. Phenomenal book. Again, I went to school. I thought I knew a lot about, autoimmunity and microbiome and all the different things. And what I learned from your book made me feel like I was in kindergarten. And then the Betrayal series, with all the different, I don't know how many you had, 80 different interview, people who you were interviewing. Every one of them brought just an amazing piece of the puzzle, to that docu-series. So hopefully it won't be another couple of years before we catch up with one another. So great. Thanks, Tom. All right. Bye-bye.